Hey everyone, as we wrap up May and as we wrap up this week with High Blood Pressure Awareness Month, let's talk about white coat hypertension. Now, this is just a fancy way of saying that your blood pressure is high when you go to the doctor's office. The idea being when you go and see the white coat, boom, your blood pressure goes up. Because often patients are nervous, they're anxious when they go to the doctor, they don't know what kind of news they're getting, or, for whatever reason, maybe they rushed to get there, whatever the case, they are often anxious or nervous. Now, could it be that your blood pressure is only high at the doctor's and then it's totally normal otherwise? Could be, but I would urge you to really look into this and think, maybe have I tried taking my blood pressure other times? Do I truly have high blood pressure to begin with? Because our bodies are very smart and our nervous system is very smart, and there's ways that it can compensate for periods of extreme stress or anxiety to still maintain a fairly normal blood pressure. So if you go to your doctor and your blood pressure is high, I would offer two things. Number one, get a blood pressure cuff at home and take your blood pressure at home, a couple times a day, maybe for 2 weeks, write down those numbers and then email them in and see, what your doctor thinks. A normal blood pressure is 120 over 80. And for a lot of patients, just taking it at home in their own environment where they're not nervous or stressed is helpful. Number two, if your blood pressure is truly different at home and in the office, take that blood pressure cuff that you bought at home and take it to the office. And the next time when they take your blood pressure at your doctor's office, you immediately retake it with your cuff and see if those numbers match up. Because truly, if it's a situational thing, then both the machines should read the same number. And if they don't, this could be an issue of calibration, and the blood pressure machine may need to be calibrated. Your blood pressure cuff may need to be calibrated to prevent these erroneous readings. So these are a couple of things to really look into. We do not want to miss the diagnosis of high blood pressure because it can really affect our bodies a lot. It can increase our risk of stroke. It may preclude you from taking certain medications. There's a lot of, other connotations for having high blood pressure. So this is something that you do not want to miss. So again, if you think you have white coat hypertension or high blood pressure when you go to the doctor's office, get a cuff at your local pharmacy and start measuring your blood pressure at home. And number two, take your blood pressure cuff in to your doctor's office the next time and make sure your numbers are actually matching up. I put out two other videos this week on how to take a blood pressure and also what is blood pressure. So make sure you watch those and tag a friend who could also use this information. Until later, bye.